Hey everyone, my name is Ray. I'm a nurse practitioner who specializes in cardiology, hospital-based medicine. If you're new to the channel, welcome. If you're not new, welcome back. This channel is all about heart disease, both prevention and treatment, other topics related to the heart and overall health and wellness. Today's a beautiful day in Florida, and so I wanted to go for a walk while I did this video. Hopefully it won't be too long. I basically just wanted to talk to you guys about the importance of checking your blood pressure at home. So I had a patient over the weekend. She came in with chest pain, trouble breathing. She ended up having an echocardiogram that showed that she had something called heart failure with reduced ejection fraction. So this is quite common. We see this a lot. Unfortunately, this was a very young woman. She was in her 50s, and she did have a medical history of high blood pressure, and so she's been dealing with blood pressure for a long time. If you've probably seen some of my other videos about high blood pressure and especially the prevalence in African Americans, but she's been dealing with high blood pressure for a long time. Unfortunately, she does not check her blood pressure on a regular basis, and that was the reason why I wanted to do this video, to just stress out how important it is. So when somebody comes in and we find out that they have heart failure with reduced ejection fraction, about 50%, actually it's a little bit over that, it's about 60% of the time it's related to blockages in the arteries of the heart. We call that an ischemic cardiomyopathy. And about 40% of the time it's what we call non-ischemic cardiomyopathy. Well, of those non-ischemic cardiomyopathies, about 50% of the time it's actually related to uncontrolled high blood pressure or hypertensive heart disease. So that is the point of this video today. I just wanted to stress the importance of, making sure that you're checking your blood pressures on a regular basis. Why? Because even though she's been dealing with high blood pressure for a while, she was on a medication, she was on one medication. A lot of times, depending on your weight, your lifestyle factors, like if you smoke, if you have diabetes, if you don't exercise on a regular basis, blood pressure is something that unfortunately gets worse if it's not well treated. And so sometimes you're on the perfect amount of medication, sometimes you're on too much, sometimes you're on too little. So, but we can't really treat that if we don't know, if we don't have the data. So what I like to tell people, I try to educate all my patients when they come in, especially with blood pressures this high, is that first of all, you should be checking your blood pressure on a daily basis. When you first get up in the morning, go to the bathroom, pee, do whatever you need to do, and then wait 5 minutes, sit down at your table and check your blood pressure and keep a log of it. And then when you go to see your doctor, whether that's your PCP or your cardiology team, show them what your blood pressures have been running. And then when we have that data, we can say, okay, blood pressures are doing great. Keep taking the medication that you're currently on, or we might need to add another medication or increase the dose of the current medication that you're taking, etc. So all these things are very important because again, a lot of times we see heart failure and it's related to what we call a non-ischemic cardiomyopathy, which means that you don't have any blockages in the arteries of the heart. It's just a matter of managing the blood pressure a little bit better. So anyhow, that's it for this video. I just wanted to do a quick video about the importance of checking your blood pressure on a regular basis. So I want to say thank you to all of the new subscribers. My goodness, you guys are just blowing my mind. It's we're up to like 468 new subscribers, I'm sorry. So so glad to see this community growing. So thanks for all the support. Thank you for the feedback that you guys have been giving me. I'm making my videos shorter, so that's why I'm keeping this video short as well. So anyway, if you have any questions about this video or any other videos, feel free to leave me a comment down below. I read them all and I answer them all. So, and of course, if you want to participate in the March Fitness Challenge, make sure to check out that video. Basically, what we're doing is a 10-minute walk followed by 10 squats and 10 push-ups. I want to get as many people as possible to participate in this challenge. So anyway, hope you guys have a blessed day, and I will see you in the next video. God bless you.